Metal-on-metal hip devices were originally thought to be a more durable alternative to ceramic or plastic models, but some studies have shown that many deteriorate faster, expose patients to high levels of metals such as cobalt and chromium, and fail at a higher rate than older implants. In fact, approximately 1 in 12 recipients of metal-on-metal devices may require corrective surgery within 5 years of implantation. If you or someone you know has had hip, knee, or joint replacement surgery, then you need to watch the following Consumer Health Report. In these next few minutes, you'll learn about the potential and very dangerous side effects that may affect you and your recovery. During this report, you'll hear from patients just like you, and you'll also receive vital information that you'll need as you embark on the journey of joint replacement recovery. Several conditions can cause joint pain and disability and lead patients to consider joint replacement surgery. If non-surgical treatments like medications, physical therapy, and changes to your everyday activities do not relieve your pain and disability, your doctor may recommend joint replacement. Stay tuned to find out how you can protect your rights and determine if you're entitled to tax-free financial compensation and what you should do to file your claim.
I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here to help. Give us a call, 800-800-4600.
My name is Sharon Jewell, and this is my husband, Ben Jewell. And Ben had a hip replacement done with the Dupree hip, and he got the one that got recalled. And he had to go in and have a revision on that hip done. And as a result of that, he got a major infection of MRSA, which threw him into blood poisoning.
Blood poisoning, also referred to as sepsis or septicemia, is a severe infection that is spread through the body via the bloodstream. If blood poisoning is left untreated, it can become so severe that it starts to interfere with the body's organs and, in the most severe cases, can lead to septic shock, where blood pressure falls to dangerously low levels and the organs start to shut down.
My name is Larry Curtis, and I've had both knees replaced and both hips replaced with artificial joints due to arthritis.
You know, the problems people can experience from these defective joint replacement parts for hip or knee, they're not minor. I mean, when somebody goes through this, it's a big deal. And first, it's a big deal because that surgery, the surgery to remove the hardware, take it out, and then put back in new hardware is an incredibly tough surgery. And the recovery and the therapy people have to go through is very tough.
The physical therapy required a lot of pain, a lot of motion, a lot of just physical pain, basically. Most of it is just getting your flexibility back by bending your knees and actually putting weight on the joint and keeping the scar tissue from building up around the joint so that you can continue to get your flexibility and mobility back.
There really are quite a number of problems you get with metal on metal. One of the problems is that you have a metal ball into a metal socket in an environment where there's liquid in there, and they're not the same metals. They make the ball out of a different metal than they make the socket, and it can create many electrical currents inside those replacement parts. And over time, that causes corrosion. I mean, if you think about it, it's just old-fashioned metallurgical science they've known about for a long time, but they apparently disregarded that when they made these hips. Clients ask me, and other people ask me, well, what should the patient do? You know, they're having issues. They've heard something about metal on metal hips or some problem that they have. So I would always start out with your doctor and give them the information. There's some symptoms that are clearly going to be from your joint. If you've got an artificial hip replacement and then all of a sudden you're having problems standing on that joint, or you're having pain in that joint, well, then that's easy, you know, to give the doctor, and the doctor's going to check into it. But there's some other symptoms that you may be having that aren't clearly from this joint. You know, we had one client who had severe metal poisoning. She did not know it. And metal poisoning is where, you know, the metal on metal over time dissolves, you know, sawdust, whatever you want to call it, microscopic, and it can get in the bloodstream. And there are tests that show whether or not you have that. Well, her real symptom was she was losing weight, and she didn't know why, and just thought, well, just getting older, don't have an appetite. But it turned out she had pretty severe metal poisoning.
Well, the hip that I had in was a metal-on-metal hip. And over the period of time that I had it in, it began to rub, metal on metal began to rub, and it began to splinter. And it was putting metal particles into my system. I had high levels of chromium in my system, and unfortunately, the doctor's office did not do as good a job of monitoring me and keeping track of this hip. I kind of got left by the wayside during that period that I had the hip in, and so it just kind of accumulated in my system over the years. And then that last year, I think it was 2016, was when I began to get really sick. And it was because the metal particles in my system had begun to poison me, and also it was causing things like my pancreas shut down, my stomach shut down.
Biggest problem is hips, joint replacements that are metal on metal, as opposed to the old-fashioned way, you can call it old-fashioned, of a ceramic ball into a socket that can be metal and with a polyethylene liner. And they tried to come up with a new product that they could sell and market as the next best thing new on the market. And companies came up and created what's called metal on metal, meaning a metal ball into a metal socket. And you get all kinds of problems that come up with these hips and these knee replacement parts that you never had before.
I did some research, and the metal on metal and having that metal get into your blood system could cause cancer or some other things, and just the pain involved with the metal on metal and the embarrassment of walking down the street squeaking like a wheel was enough to have me do the revision.
As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place, and many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600. So I understand this is complicated stuff. And if you still have questions after seeing what we have available online, after checking things out on maybe other websites, whatever, that's why we're here. Give us a call. We'll try to help.
There's no question that hip and knee replacement surgeries can ease pain and increase mobility for patients. But an unexpected side effect from some metal implant devices is metallosis, a type of metal poisoning that is very severe. The condition, linked to metal-on-metal implants, causes muscle pain, tissue death, bone damage, and other problems. Patients may face other risks from hip replacement surgeries, but should be aware of metal-related blood poisoning and consult a physician immediately if symptoms appear.
One example, I think it's a good example for anybody out there to understand how all these situations are unique to every person. But, we've got one client who had 2 metal-on-metal hip replacements, and one of them, his problem was it started squeaking. And this is an educated person, a professional, and yet he has 2 hips. One of them starts squeaking, and he was embarrassed. And so his answer to that was, well, he'd start carrying luggage with him, so people wouldn't think it's his hip squeaking, it's a luggage. And yet it turned out that was a real problem. This is an educated person who thought it would be okay, and then he thought, well, my other one will be okay, even though it was the same product, same company.
After a couple years, I had one of my hips started to squeak, making a really loud squeaking noise, as if you had a squeaky wheel on a suitcase. And then I started getting the pain with it, and I finally went back to the orthopedic surgeon, and he said that it was one of these Depri joints that had a recall, and that he was going to have to do a revision on that joint, which was basically a metal ball on a metal joint that was causing the problem.
The original hip the Dupree hip, it was that the ball and joint was too tight. And as he rotated that hip, then the metal shavings would come off. And so the hip just did not work right from the get-go. And that's why it had to be revised. And then as a result of the surgery to revise his hip is when the infections all set in. It got infected then.
Well, in 2010, I had a hip replacement done. And within 2 months of having the hip replaced, I got a recall notice from DuPay, the manufacturer of the hip, saying that my hip had been recalled, which was very much a shock to me. So I contacted my doctor, and he said he was working with them so that they would know what they needed to do next. So then he called me in for an appointment, and I went to see him, and he said, since it's only been 2 months since we put your hip in, and you're just now finishing with your rehab, I think we should leave the hip in and just monitor you and keep a track of it and be sure that nothing goes wrong, because I don't want to take you through surgery again. So 2016, the spring of 2016, I began to have health issues, one right after another. I began to lose weight. My hip was bothering me. I went back and forth to the hip doctor, and they kept telling me it was bursitis, and they took blood work and they did x-rays, and then I began to have trouble with my kidneys, my bladder. I probably went to maybe 4 or 5 different doctors trying to determine what the issue was. In the meantime, I'm losing 2 to 3 pounds a week.
Well, when I found out that the part was faulty and that it needed to be replaced, I knew I was going to have to go back under the knife again and get the surgery done, and then do the therapy all over again, which was something I didn't really look forward to, because I didn't look forward to the therapy the first time. But it is what it is, and I had to have it done, so I had it done. And I guess the surgeon told me that about 1 out of 10 of these devices fail of this type of Dupree implant.
As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place, and many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600. There are clients we have who had extreme problems. An example is a client of ours who had so much infection that when they went in and took out the defective hip, they couldn't immediately put back in a new hip. She had to go without a hip, something called spacers, for a period of months while they kill out the infection and let her heal up. That's an exceptional problem, but it happens more than you might think.
And while I was in the emergency room, I had a terrible time because my heart acted up and they had to put the paddles on me twice, and I was a mess. They called the orthopedic doctor on call in that night to take a look at me, and he came in and he said, if I hadn't just come out of surgery, I would take you straight back into surgery. That hip has got to come out. It is poisoning you. So the very next morning, they did hip surgery on me and took the old hip out, and it took longer than what they thought it was going to because there was so much infection and so many things had gone wrong, and so they couldn't put a hip back in. They put a spacer in, which is a concrete thing that has medicine in it. And they put that in to try to clear up all the infection. A week later, they had to go back in and put a second spacer in, which meant they had to do surgery again. I was in ICU for over a week. I was in Vanderbilt for nearly 3 weeks because they were trying to clear the infection up.
The blood poisoning then infected his knee on the right side, and also the joint on his left foot between the toe and the foot. And they had to go in and remove all of the hip joint, all of the knee joint, and operate on his left foot, open it up, drain it, and put in antibiotic pellets. And as a result of this, he had no joints on the right side and had to be in a rehab center for 5 months because he had no joints. Also because he was on all of these IV antibiotics and everything. So after, it was probably about 4.5 months, the infections were clear and they were able to go back in and put the knee and the hip joint back in. But then he had to go back to the rehab center because he hadn't walked in almost 6 months. And so we had to spend another month in the rehab center learning to walk again.
As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place. And many of those people are having problems. If you're one of those people and you're having problems with your artificial hip or artificial knee and you're not sure what it is, and you don't understand your rights, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600.
Metal ions from a metal-on-metal implant can enter the bloodstream. There are case reports in which patients with metal-on-metal hip implants may have developed an adverse reaction to these metal ions and experienced medical problems that could have been related to their implants. These problems included general hypersensitivity reaction, cardiomyopathy, neurological changes during sensory changes, psychological status change, renal function impairment, thyroid dysfunction. Metal-on-metal hip devices were originally thought to be a more durable alternative to ceramic or plastic models. But some studies have shown that many deteriorate faster, expose patients to high levels of metals such as cobalt and chromium, and fail at a higher rate than older implants. In fact, approximately 1 in 12 recipients of metal-on-metal devices may require corrective surgery within 5 years of implantation. Side effects may include bone loss caused by device loosening, clicking, popping, or grinding in the area of the hip implant, difficulty and pain when walking, standing, or carrying weighted objects, dislocation or loosening of the implant, earlier than normal failure of the hip replacement, fractured hip bone, infection, metallosis, rash indicating necrosis, osteolysis, severe pain, swelling of hip, thigh, or groin area, tissue inflammation.
They didn't want to release him from the rehab center because they didn't think he was ready to come home. But he was not making any progress. He needed to have a goal. He had, in his mind, decided he was probably going to spend the rest of his life in a nursing home. And I needed to give him hope that he would come home. And so I fought them tooth and nail to let me bring him home. And he had goals he had to meet in order to come home. He had to be able to get himself out of bed on his own, at least into a standing position. And he had to be able to walk to the bathroom. And he had to be able to walk from his bed out here to the kitchen table for meals, which is about 100 feet. And once we gave him those goals, his recovery was remarkable. I mean, within 2 weeks, he was up walking up and down the halls of the rehab center and everything else. And so, he had hope again, hope that he was going to be able to come home. So, there's risk. Anytime you undergo an anesthetic, there's risk. And so he was put through that, and now he has to go back in and have another surgery and go through the same risk again. And then to find out, and then all of the complications that arose as a result of the second surgery. I mean, it makes you mad. It's like he could have died. I was told twice, he was pretty much out of it, but I was told twice he would not live.
Of course, right after I came out of surgery, the girls had talked to the surgeon, and the surgeon said, you've got issues here with this hip. And he told them, he said, this is one of those hips that was recalled. And he said, I think you should see an attorney. So the girls came to me that night after surgery, and they said, Mom, what do you think? And of course, living in Bowling Green, Kentucky, I knew of the Hughes and Coleman firm, and of course I knew some of the attorneys there and gone to church with Mr. Hughes and his family. So I said, well, Hughes and Coleman, there was no doubt we'd go through them.
Well, after I had the revision done and my orthopedic surgeon said I ought to be calling somebody about this, he suggested Hughes and Coleman, and so I called them. And they said they would be right out and talk to me, and it was a very easy process. They helped me go through the legal part of it.
A good example that we've seen is one company, when they started selling a product here in the U.S., they had already taken it off the market in another country when it had problems in that country. And you think, well, how could that happen? And yet it did.
All I know is that he's been there for me and helped push me to get things accomplished that I would have taken a lot longer to get done had I even worked at getting them done. He's still pushing me. I need it. I like it. And I'm certainly glad she's there.
As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place, and many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600. One of the things I've heard from clients at the end of the case is they didn't expect it to be as easy for them as it was. What we want to do is, get started, get the paperwork, get started, and then a few phone calls, get some information from them, get all the dates and where they had their surgery, and then we're off to the races to get the records that we need, and we can let our client focus on getting better, worry about their health, and we'll worry about the legal part.
Once Hughes and Coleman became involved, they just took over. I mean, other than us giving them information, dates, and doctors' names, and all this, that, and the other, I mean, they just took over.
A contingency fee is a payment arrangement that allows a person who has been injured to obtain legal representation, even if they don't have the money to pay a lawyer at the beginning of the case. A client does not have to pay a contingency fee up front, agreeing instead to pay an attorney a percentage of the award after they collect damages or monetary compensation.
Clients and patients out there who are facing this issue still wonder and think that, well, if I hire a lawyer, surely it's got to cost me some money. I can't afford this. And you have health insurance that'll pay your medical bills most of the time, but what about my legal bills, and what about the expenses of all this? And the paperwork our clients sign up front is very clear. It's in writing that they don't owe us anything if we don't get a settlement for them and don't recover money for them. And yet, I still will be talking to clients, when we're evaluating their case, and they say, well, I don't want to do that. I don't want to owe money. And so I have to explain again how the whole process works. Contingent fee. Contingent just means if something happens, then we get paid. And that if is if we get money for our clients. As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place. And many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600.
I lost 2 years of my life because of this hip, and I want them to know that, and I want them to pay me back for it. I feel like I did go through a lot of pain and suffering. Like I said, I was disabled and in a wheelchair for months and months.
One of the things I hear from clients from time to time at the end of the case is, maybe for them it wasn't just about the money. Maybe they had health insurance, but somebody had done something to them, and to sit there and do nothing, it's forever, in the back of their mind. So by pursuing a claim and by holding the company accountable and by making the company pay a settlement at the end, they get some sort of closure. For them, then it's over. Yes, they still have the problems, and they have that anyway. But at least as far as what the company did, they don't feel like they just let them off the hook and have to continue to worry about that the rest of their lives.
So after I called Hughes and Coleman, I felt that they were going to represent me well, and that they were able to bring this lawsuit against this Dupree and make sure that, you know, the fact that the settlement was nice to have, but it actually made sure that these companies are held accountable for their products that they're putting out on the market. And so, you know, the money's nice, but the fact that maybe we could help somebody else before they actually make the decision to go in there and have their hip replaced or their knee replaced, that they do some research and find out that they get the right part for the right joint.
As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place, and many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600.
I feel like Dupree should be responsible. I think they should be more responsible, and I think that people that have issues like this and they know that their hip or their knee has been replaced with something that is faulty, I think that they should take action. And I think Hughes and Coleman would be a good law firm to go to, because they have really stuck by me and done a good job of taking care of me.
I think another aspect of it is, you know, they've gone through a joint replacement surgery already. You know, they had to go in and have a hip replacement or a knee replacement, and it's a tough surgery. The rehab and the therapy and all that is just tough and it's painful. And so they'll just convince themselves, well, no, it's not that bad, or it must be something else, because really deep down they can't think about having to go through that surgery again. So if you're out there and you're having problems, you know, find out what it is. It'll be your choice whether or not you have to have a replacement surgery, but you need to know what you're dealing with, and if you have a claim, you need to know about that. I've just seen so often that the clients we represent, they don't have all the information, they don't know everything, and then they're making these decisions based on their own personal situation of, well, I guess I'm just older, or I'm not going to go through that again, so I'm just going to put up with it. So if you're just putting up with it, look into it, find out what you have, talk to your doctor certainly, check it out on the internet, you can find out information, but check with us, check with a law firm that does this and can find out what you have, tell you what you should do. As we sit here today, there are literally millions of Americans out there who have had joint replacement surgery for their knee and their hip and have an artificial joint in place, and many of those people are having problems. I'm Lee Coleman with Hughes and Coleman. If you have questions about a joint replacement surgery you've had, whether it's a hip, a knee, an elbow, whatever it might be, and you're having problems with that and have questions, we're here, Hughes and Coleman, and we can help. Give us a call, 800-800-4600.
Call the number on your screen to find out how you can protect your rights and determine if you're entitled to tax-free financial compensation and what you should do to file your claim.